Oh, yes. Good afternoon. I'd like to call to order the Health and Human Services Committee of the Mecklenburg County Board of County Commissions, May 21st, 2024 meeting. I'd like to welcome those who are in the audience as well as our guests online. And I'd like to start off by having the commissioners introduce themselves, and then we'll go by the senior staff. And this time we won't ask the presenters to double introduce themselves. They'll introduce themselves once they get up to the podium to make their presentation. So without further ado, I'll look to my right and ask my colleagues that are members of the committee to introduce themselves.
Good afternoon, I'm Laura Meyer and I represent District 5.
Good afternoon. I am Mecklenburg County Commissioner Elaine Powell. I represent North Mecklenburg, Huntersville, Davidson, Cornelius, and North Charlotte. And I am very excited about today's meeting. Thank you.
Good afternoon. My name is Arthur Griffin and I chair this august committee of county commissioners. We have a guest commissioner, but she's here all the time. Maybe the chair might appoint her one day, but I would like to ask our good friend to introduce herself.
Thank you. Commissioner Susan Rodriguez McDowell, elected by the people of District 6.
We have a phenomenal staff. I'll start off with our deputy. We had another commissioner somewhere? You?
No, sir.
Oh, let's start off with our deputy county manager, Mr. Trotman, please.
Good afternoon, Anthony Trotman, Deputy County Manager.
Good afternoon, Kim Henderson, Director, Child, Family, and Adult Services.
Good afternoon, Stacy Lowry, Director of Community Support Services.
And we have one other, we have an Assistant Health Director that's sitting in for Dr. Washington. Dr. Kim Scott, who is over the programs that Public Health will be presenting today.
Welcome, Dr. Scott. All right. Staff that's that are not presenting.
Hey, good afternoon. I'm Lacey Jones, Social Service Manager for Mecklenburg County.
Greg Cannon, Division of Practical Services for Adults.
I'm just here for a college class.
Good afternoon, I'm Dr. Shaquetta Johnson, Assistant Health Director for Preventive Health in Mecklenburg County Public Health.
Good afternoon, Dr. Korsha Kaufman. I'm the Senior Social Services Manager within CFAS.
Good afternoon, my name is Letitia Lodholt. I'm the Deputy Director with CFAS, Child and Family and Adult Services.
I am Alex Burnett with the Public Information Office.
All right, go to my left.
Good afternoon, I'm Yolanda Griffin, Director for Department of Community Resources.
Afternoon, everybody. Robert Nesbitt, Chief of Staff for Health and Human Services.
Good afternoon. My name is Jessica Montana, and I am a Health Program Supervisor with the VCAS program.
Okay, is that it? Other than those who are going to be presenting this afternoon? Excellent, wonderful. The first item of business, of course, is to approve our minutes of our previous meeting. Is there a motion to approve the minutes?
So moved.
Is there a second? Second going once.
Oh, second. Sorry.
Any discussion? Hearing none. All those in favor of adopting the previous minutes, say aye.
Aye.
Pose the same sign. Hearing none. We'll move on to the topics, the excitement that Commissioner Powell spoke of earlier. I'll turn to our Deputy County Manager to introduce our topics. Committee members, if at all possible, can we take really good notes during these presentations and then at the end, follow up. Is that okay? Or
Unless there's urgency.
unless there's urgency,
Yeah.
but okay, but take good notes so that we can use our 3-minute rounds to really drill
Oh, I see
down
what you're saying.
on
Of
those
course, of
questions.
course.
All right. All right, Mr. Trotman.
Well, we have two presenters from Public Health today, Dr. Chantel Lowry and Ms. Ebony Rao, who are going to give you an update on our violence prevention plan that is inclusive of the work that we're doing with our recast SAMHSA grant. And Ebony will explain what recast is.
Thank you and welcome.
Good morning, everyone. We're so grateful to be here to share with you some of the wonderful work that's being done here in Mecklenburg County to advance our objectives and our strategic plan for violence prevention and resilience across our community. Again, my name is Ebony Rao. I'm the Senior Health Program Manager for the RECAST program, which stands for Resiliency in Communities After Stress and Trauma. And I'll allow Chantel to introduce herself.
Good afternoon, everyone. My name is Dr. Chantel Lowry. I am a HOOK program supervisor with the Office of Violence Prevention with Mecklenburg County Public Health.
Welcome.
Thank you.
I was just looking to make sure that I'm following my cues. So I also wanted to go ahead and just bring to light some of the things that we have seen across our community, not only related to violence, community violence in particular, but also related to the mental health crises that many of you have been aware of that is taking place across not only Mecklenburg County, but also across our country today.
So when we think about the why do we want to address community violence? Why do we have violence prevention? We look at the data. And so if you look here at this chart, specifically for homicides and emergency department visits that are due to firearm injuries, Mecklenburg County has higher rates than North Carolina as a state. And then if you look at it broken down by race and ethnicity, African Americans have a higher rate as well, other than any other race. This is consistent with data that is spelled out in the plans that are in front of you, which states that African-American males ages 18 to 24 are the priority population to be homicide suspects and victims, almost 90%. And so when we look at the trends as well, having it worsening, this is some of the reasons that we want to make sure we are addressing this problem in our community.
Additionally, some of the things that we have noticed is that many of our youth are stating they have access to weapons and that they have also brought weapons to school within the last month, that they have reported being injured by a partner. What we are seeing with our mental health trends is that they're from 2017 to 2021, when we looked at the data, that there was a slight decrease in the number of attempted suicides. However, what we're also seeing is that there is an increase in a specific population where attempted suicides are occurring, and that is with young Black men. The percent of suicide of teens who planned to die by suicide has increased, and the number and percentage of teens who are stating that they feel hopeless or sad almost every day for the last 2 weeks has also increased fairly significantly. And so we need to begin looking at how we can address these issues, in particular among our youth populations.
And so from these two, we identified from the community health assessment, these two indicators that will be addressed and kind of looked at when we look at the health of Mecklenburg County residents. So looking at homicides and firearm injury ED visits, the status is also worsening. And so we want to make sure that throughout the 5-year plan, we are looking at this every year, revisiting it, seeing how it's going, and making sure that we are continuing to do the right strategies to address it correctly. And so what is the OVP? The Office of Violence Prevention, we were established in November of 2020. We were the first Office of Violence Prevention within North Carolina that followed this public health framework. And our main role is to really connect and convene different organizations, entities, residents, government officials to kind of create this violence prevention ecosystem where we have a shared vision of increasing trust among partners so that we can all address this on the same page. And our office really leads the charge of developing and implementing this 5-year strategic plan, the way forward.
And for those of you unfamiliar, RECAST, which stands for Resiliency in Communities After Stress and Trauma, is a 4-year SAMHSA-funded grant program embedded within public health. Essentially, our work is to increase the work that's already occurring in our communities in building resilience and mental health support through educational opportunities, by improving access to quality evidence-based mental health care, and also to collaborate with the Office of Violence Prevention and curbing some of the community violence that we're seeing through innovative and trauma-informed ways.
So when I talked about this ecosystem, we have the Office of Violence Prevention here in the center, and we are definitely supported and surrounded by the strategies and programs of RECAST. And then we have these 4 pillars that kind of branch out and help us move this work. So we have advisory groups, community engagement, data and evaluation, and infrastructure. And these are all of the partners that make up the ecosystem that is ever growing, that is helping us continue this work. Not at all an exhaustive list of the partners that we see, but some of the ones that we contractually support. And so I'll go over the community engagement and advisory group section. And so for the community engagement partners, they're really the ones that are helping us implement the strategies that are in the way forward, implement a lot of these violence prevention programming, the ones out there providing community education. Something like CVPC are the groups who are coming together to network to help share the resources that are available for everyone. And then we have our hospital partners like Atrium Health and Novant. For advisory groups, these are individuals who are working together to move forward the things that we have stated, to come up with different strategies on how to do it better, what may not be working, what has been achieved. And so we have the Violence Prevention Core Team, 100 Youth Advisory Council, and the Way Forward Advisory Group. And I'll speak of those a little bit later in the presentation.
Additionally, we would love to highlight the work that's being done with our data and evaluation partners. It is very important and key to the work that we're doing that we are consistently providing evaluation data, not only for our improvement, but also for our community's benefit, to better understand how the work we are doing will be able to increase the work of resilience across our community and decrease community violence. So we are partnering currently with Northeastern University, UNC Charlotte, and Common Good Data, all who have worked with us to create evaluation plans so that we can not only disseminate information as we receive it, but so that we can also look at the methods that we need to change within our programs to make them more effective, more efficient, and more community collaborative. When looking at our team, we would like to just highlight that we are a very diverse group of individuals coming with backgrounds, not only in violence prevention, but also in mental health, within public health and chronic disease. We have individuals who are bilingual, and we also have individuals with expertise in data and evaluation. We have investments from our local county government, as well as multiple grant funding opportunities. This includes $543,000, of course, as an operating budget for the Office of Violence Prevention, funding we've received from ARPA, as well as the RECAST grant from SAMHSA, which is $4 million over the course of 4 years.
And so within this 5-year strategic plan, we have these 5-year goals, which is to reduce homicides and gun-related assault rates by 10% from that baseline data that was gotten in 2022. And we will do this by achieving it through these areas of focus. So there are 5 areas of focus that we will focus on in the plan. And today we're going to talk about the ones that have some significant milestones and things that we have achieved. And so I'll just quickly go over some of them. Community engagement and partners really looks at when public and private stakeholders can come together to address violence prevention and affect change for the community members. Support for Youth and Families looks at youth and families who have been affected by violence or labeled as high risk for violence, and looking at what both physical and mental health services, so behavioral health resources, are out there for them, so that we are supporting healthy families. Economic Opportunity looks at these same instances of people who have been affected by violence or high risk, and making sure that they not only can get jobs, but keep jobs and have upward mobility. We have Intergovernmental Collaboration, which looks at community organizations as well as county officials and local government to come together to reduce violence in the communities. And last but not least, Safer and Healthier Neighborhoods. So if we can address the first four, then we are creating safer and healthier neighborhoods for the residents of Mecklenburg County. And so for the first area of focus, community engagement and partnerships, some of the milestones are that we have been able to establish a shared decision-making and feedback framework. And this is done through our 3 core advisory groups. So the first is the Mecklenburg County Violence Prevention Core Team. This is made up of senior leadership, executive team members, law enforcement, county and city government officials who come together to talk about things that are happening in the way forward, seeing where they are and coming up with strategies and suggestions to move it forward. The Way Forward Advisory Group is a group of community members who have volunteered to come together and help us move forward the strategies in the way forward. So they not only meet together as a whole to meet that 5-year goal, but they also have subcommittees that address each of the areas of focus so that we are making sure that everything gets the attention it needs and we are reaching out and using all of our resources. And then the 100 Youth Advisory Council has really been developed to bring the youth voice to the table and making sure that we are not creating policies and practices for an age group without hearing their voices and understanding what they're going through from a firsthand perspective. We have also designed and implemented countywide communication campaigns with both violence prevention and mental health messaging. So we have a couple of examples here in the front of our Not Another campaign that we will continue throughout this next gun violence awareness month. And then we've also launched our Peacekeepers Academy, and Peacekeepers Academy is really designed to give community-based organizations who are nonprofits the opportunity to really boost up the work that they're already doing in the community against violence prevention. So they're already the ones out there with different programs affecting residents, and we just want to make sure we give them the tools to continue to be sustainable in that. And so they learn things like grant writing, what grants are available to me that I don't know about? How can I effectively write grants to make sure I'm getting all the support that I need? What can I do with the data? So the data that I gather, how do I effectively use it to evaluate my program and make it better? And so we just finished our first cohort in February of 2024, and we are currently in the second cohort of the Peacekeepers Academy.
Additionally, Recast wanted to find ways to support this work moving forward and to recognize the impact of mental health in the work of community violence prevention. So one of the important things that we recognized was there are many communities who do not have the opportunity to receive a lot of the mental health related supports that they can then utilize to support others. So we wanted to make sure that our communities, in particular, our priority health zip codes, had opportunities to receive some of those workshops and trainings. And that included things like QPR, which is a suicide prevention workshop, Resilience and Thriving, which works to help individuals recognize the power of resilience in the midst of stress, child-adult relationship enhancement, mental health first aid, and many others. And so what we did was that we went into our communities and asked who would like to be a part of this work and become a trainer so that they can then provide that within their communities. We recognize that those in the communities providing these workshops can do a better job than someone who is outside of their community coming in. They already have buy-in with those that they live with, work with, and thrive with. So we offered opportunities for Train the Trainer, and those individuals are now in our communities providing these supports. In the year 2023, the second half of the year, we were able to train 330 individuals from across our community in these evidence-based approaches.
And so in addition to the poster boards that we have here today, these are just some images that also had our Not Another campaign from Gun Violence Awareness Month and the many different areas and ways that we were able to promote it, just really raising awareness, putting it out in high traffic areas, having big billboards on the back of the CATS buses. And then to the very far right, we have our Clean Graffiti campaign, Violence Free Zone. And so this is spread out all across Mecklenburg County in all the different priority zip codes that Ebony has spoken about, where people can see them and kind of bring their awareness and ideas of that we are trying to create a violence-free zone within Mecklenburg County.
Additionally, we wanted to talk about the work that's being done and the need for emotional and social supports, and that included raising awareness of mental health and mental illness. And so Recast and the Office of Violence Prevention partnered to launch some different awareness campaigns to talk about how we can all recognize that we're not alone and that we have additional supports. In particular, with the launch of 988, we wanted to highlight for our community that there are resources available 24/7.
And so for our second area of focus, we have support for youth and families. And so under this one, we have been able to expand access to our community-based youth mentorship programs through different partnerships such as the YMCA. We have been able to work with them to provide memberships to youth and young adults, as well as siblings and a caretaker, so that we're giving them opportunities to do things outside after school and during the summer, kind of giving them a different outlet. We're also working with Shining Hope Farms, which uses equine therapy. And so they have mental health group therapy sessions, individual therapy sessions, and also give the opportunity for youth to ride horses. So they're in a different environment and kind of being able to talk things out that way. And then we have Our Daily Bread, which uses baking to spark conversation with youth and young adults. And so they're able to come together, learn a new skill, interact with the facilitators, and then you have conversation with each other and the adults in the room on what they might be going through. And so all of these contribute to our youth development activities. And as well as we've been able to sponsor the Youth Violence Prevention Conference, which just happened last month, the end of last month. And we brought together youth there as well. We had a whole panel, if you're able to attend, which was very powerful because we were able to have firsthand experiences of what they go through and what they may need. We also work to help pilot Handle with Care. And for those who are not familiar, Handle with Care is a partnership with CMS, where law enforcement are able to notify schools if they go to an incident and there's a traumatic event and the child experienced it and may have some feelings from it, whether it's the child that was directly affected or whether they were just in the home next door. They're able to write a note that says Handle with Care to the school, and then no other details, but it gives not law enforcement, but counselors, teachers, staff at the school awareness that that child might need extra support. And so right now that is in 11 of the schools within the CMPD Freedom Division. With this breakdown, 6 elementary, 2 middle, 2 high, and 1 alternative. Looking to, for the second year, to go to half of the rest of CMS schools, and then by the third year to have it in all of the CMS schools.
Along with that partnership, we wanted to ensure that not only are our youth receiving direct services, but that those in our community who are supporting youth and families also have the support they need to do the best that they can to serve those who need it most. So in doing that, we wanted to recognize some evidence-based opportunities that were brought to Mecklenburg County, including Familia Adelante, which is a program specifically for our Latino population, our youth, and their parents who are able to address issues of substance use, mental health, and acculturation gaps between parents and youth. We provided a train the trainer opportunity, and we currently have approximately 30 or so individuals across the community who are implementing this evidence-based program with youth and families. We're also launching Notebook Navigators, which many of you are familiar with, called Carla Carlisle, who is a local trauma prevention advocate. She and her son have written a book, an interactive journal for children, who can then document some of the feelings that they have and attend a workshop that really helps them to identify those difficult feelings, especially those who have been impacted by trauma or grief of some other kind. And so with that work, we've been able to partner with our YMCAs, with our YWCAs, with many after-school programs to bring that to the youth in our community, elementary age, to talk about some of the difficult feelings, but more so talk about how to cope with those in a safe environment. AFCBT, Alternatives for Families Cognitive Behavioral Therapy, and TFCBT, Trauma-Focused Cognitive Behavioral Therapy, are both evidence-based treatment modalities that our therapists in our community can implement. In doing the community needs assessment, we recognized many of our therapists across Mecklenburg County feel overwhelmed. They do not feel that they have the support needed or the funding needed to be able to receive the evidence-based training that they need to do the best they can to serve those who are most impacted by some of the community violence and other types of trauma that they see. So RECAST brought in trainers from the University of Pittsburgh, as well as North Carolina Child Treatment Program, to be able to offer some of these cohorts and really build capacity in our community to address trauma in our youth and in our families. We're also providing care facilitator training so that more of those agencies and individuals who would like to have that child-adult relationship enhancement workshop can have it accessible to them. And of course, we recognize that sometimes we need to ensure that we're being intentional when we're talking to our youth, when we're talking to our parents about the experiences that they're having. And we want to be intentional by really creating things that will help them to see the importance of the work of mental health and resilience in our communities, such as this, which shows that the presence of a supportive relationship has a greater impact in promoting well-being than the complete absence of adverse childhood experiences. And we know that many of our youth are experiencing high levels of ACEs or adverse childhood experiences, but by supporting those who are supporting them, we can help them to be more healthy, both physically and emotionally.
And so for our fourth area of focus, we have intergovernmental collaboration. So this is really about increasing awareness on the strategies and the way forward and helping us implement them. And this has been done by attending and presenting at different committees. We also established 100 Youth Advisory Council. So I spoke of earlier, this is about bringing youth voice to the table. We have 3 branches: middle school, high school, and 18 to 24-year-olds. And they are really there to spark conversation and provide suggestions and recommendations on different programs, policies, and practices that affect them, how it makes them feel, do they have safe spaces to go to, and what can be done so that we are effective in approaching violence prevention in this age group. We have also accompanied an instructional guide for the conversation to help guide the facilitators. We've been able to tap into some different community-based organizations who are already working in the schools and already working with this age group. So they're a trusted adult who they feel comfortable having these conversations with so that we can properly present these and start making some change.
One of our major partners is CMS, and the work that they are doing within our schools to really promote emotional well-being amongst our students is phenomenal. And so we wanted to partner with them to expand on some of the work that they're currently doing. We will be bringing in trainers at the beginning of June for the Sources of Strength curriculum. Sources of Strength is a national nonprofit that teaches local educators how to create teams within their schools of peer leaders. And those peer leaders, those students, develop campaigns to promote emotional wellness, to promote suicide prevention and violence prevention. We will be hosting that here in June with CMS and multiple local charter schools so that they can also bring in Sources of Strength curriculum and have peer leaders to promote mental health and violence prevention.
And last but not least, we have safer and healthier neighborhoods. And so for these milestones, we've been able to expand our violence interruption team, which is Alternatives to Violence. So these are individuals who are known to the community, to the different corridors, might have been just involved, but are able to speak to these youth and these residents on ways to stay out of violent situations. If something happens, they are there in the community to address it right away. And they're also there to be able to speak to each other to make sure that we prevent retaliations and things like that. And so we have these groups in 3 sites, Betty's Ford, West Boulevard, and Nations Ford. And then we've also been able to expand our hospital-based intervention to both Atrium and Novant. And so individuals that come to the hospital are able to be linked to different resources and groups after they've experienced something traumatic and been involved in a violent situation, to help them stay out of the situation or to help improve their overall lifestyle that might have gotten them involved in the first place. We've also been able to conduct an assessment to really understand and inform best practice as far as the I-85 Sugar Creek corridor. And so we had someone come and do an assessment throughout the day. So what happens during the day, what's happening during the night, getting together individuals who work closely within that corridor to really understand what are their top needs, top things they want addressed within this corridor to improve it. Some of those included the unhoused, so the housing situation, drugs, the fact that youth in that corridor have nowhere to go after school or during the summer. And so these same group of individuals will now come together to think about what resources are available to bring in so that we can improve some of these top key indicators that were identified.
We recognize, just as Dr. Lowry mentioned, that we cannot do this work without the voice of those with lived experience. There are so many valuable individuals in our community who are already doing this work, and we want to highlight what they are doing and also provide them with some of the resources they need to continue doing that work. That may, for us, involve peer support and wellness recovery action plan, or WRAP. Those things allow for those who are coming into our spaces, who are providing the vision that they see for those with lived experience, for those who have previously experienced or currently experiencing mental illness, substance misuse, as well as justice involvement, that they are able to provide voices to highlight some of the needs that they may have and to provide the support. So we wanted to be able to bring that work to light here in Mecklenburg County and also advocate for the work that they can do, because oftentimes they are left out of those conversations and also left out of employment opportunities, even though they can bring such valuable pieces to the table. We're also partnering with many of our Latino community partners, such as Latin American Coalition and the Faith and Health Latino work groups, to make sure that we are really talking to all of our citizens within Mecklenburg County and providing them with the support that they need to move forward, to have violence prevention be at the forefront of what they're able to provide to their communities, as well as talk about the value of mental health and wellness.
So upcoming next month, June, is Gun Violence Awareness Month. So we'll be doing a lot of activities with education and awareness campaigns similar to last year. We also have a new component called Faith in Action. And so we're looking to get houses of faith involved in this conversation, as well as reaching out to the communities that they serve. And so we're asking houses of faith to commit to one actionable thing in June that will promote violence prevention within their community, whether it's a food bank that they already have, a gun law giveaway distribution. So we'll look out for more information with that. We also will have our current Peacekeepers Academy graduation this next month in June as well. And then we are looking to provide some performance-based funding for the Way Forward Community Implementation Grant next fall, this coming fall in 2024.
Recast, in partnership with the Office of Violence Prevention, will be hosting a summit called Reframing Resilience. That takes place next week on May 30th. It is in conjunction with South Piedmont AHEC. And we're very excited to be able to have some of those meaningful conversations across our community to talk about how we can reframe the conversation we have about resilience and really work towards a more cohesive group in promoting mental health, wellness, as well as violence prevention in our communities. I invite everyone to register for that on the South Piedmont AHEC website. This Is My Brave is a national nonprofit that does the work of healing through storytelling. And so Recast, again, in partnership with the Office of Violence Prevention and many other community partners, will be bringing This Is My Brave, the show, to Charmec in 2024. That is in September. And it's through that work that we will have a show where individuals with lived experience for mental health and recovery, who are youth, who are adults, and who have also had experiences with with violence in their communities to share their stories of hope and resilience. Of course, we're also doing those evidence-based modalities with our clinicians, and we're excited to be able to add another 80 clinicians to our community who have this evidence-based training beginning in June and going through this upcoming October.
And then we will also be finalizing the Way Forward evaluation plan. And it's important that we emphasize that this work is not just with public health, it's just not with the county, not just on the residents, but it's a collective effort for everyone to come together, thinking back to that ecosystem and addressing this violence prevention. And so we just have a few images to kind of display what that community collective work looks like. And so here, this is our first cohort of Peacekeepers Academy. We had 10 total organizations who went through the 8-week interactive session, and then they were provided funding to do violence prevention scope of work in the community. So now they are currently working out those scopes of work and making change in their communities. And then we also have to show what the leadership team looks like who are helping to move along these strategies and programs as well. And so we have Dr. Washington, Dr. Scott, and then our OVP team.
And as we mentioned before, many individuals and agencies across our community have been engaging in care training, child-adult relationship enhancement. We were super excited to be able to provide this to many across our community. And by doing a facilitator training, we will have more individuals in Mecklenburg County than any other area in the state who can provide care training to anyone from MEC Pre-K to Smart Start to behavioral health and our YMCAs. And of course, we were very fortunate to be able to bring out Dr. Joel Bennett, who was able to give a training of trainers for resilience and thriving. And these individuals came from many parts of our community, providing peer support, providing health education, and those who are just living in their communities on the corners and can provide some of these workshops with those in their space. We're very fortunate to be able to see faces from NAMI, from Atrium, from CMPD, and from Public Health. So we're looking forward to being able to bring these workshops across Mecklenburg County. If there is any additional questions from our community members, of course, they are more than welcome to reach out to us. The Office of Violence Prevention, the website can be found on Mecklenburg County's website, as well as the Recast website, which is also on the county website, gives people an opportunity to also register for classes or trainings or some of those wonderful things that we're doing in the community. And for those who are interested in joining the Way Forward Advisory Group, you're more than welcome to email us and reach out. We would love to have you be a part of this work.
Well, thank you so much, Ms. Rayo and Dr. Lowry. I really appreciate that. I will look to my colleagues and see if there's any super burning issues. If not, I hope we can go into a 10-minute presentation on transportation, and then we all can ask questions. But let me see if there are any burning. All righty, excellent. We can go right into the transportation presentation. All righty, then we'll have plenty of time to ask those burning questions.
Yes, thank you, sir, Commissioner, and all the other commissioner committee members and our visiting commissioner. 10 minutes.
Well, I'm just looking at the agenda, that's all.
We will do it. We will do
I
it.
didn't do the agenda.
Thank you for the opportunity to present today on our communication plan that we're preparing to launch with regard to implementing our MTS trip program modification. I have here the talented team from Services for Adults. Macy Jones is going to help keep me honest here and pinch hit with questions if need be. We also have Dr. Korsha Kaufman, who is our Senior Social Services Manager, Greg Tanner, who many of you know, our Division Director, and our fairly newly appointed Deputy Director, Letitia Lodeholt. I was, before I go deeply into this, I was with you all in April, if you will recall. So there are some early slides that I included from the presentation that I did before the full board in April, just as a level set. You'll have it in your materials to refer back to, but I won't spend a lot of time on that front matter necessarily. I'll spend more time into the communication plan that we're preparing to roll out. We are within Mecklenburg transportation system at a bit of an inflection point post-pandemic. And so as a result of the restriction of funding, the elimination of funding that really bolstered our ability to scale and support members of the community with trips that we don't typically provide, that we did not typically provide prior to the pandemic. We are now at a point in time where we really need to focus on prioritizing the types of trips that are most essential and crucial for our community going forward. So again, these next few slides are from the presentation that I did in April. The team within MTS essentially has two large scopes of work in terms of Medicaid trips, which we are not talking about in this presentation, but Medicaid trips are the most significant aspect of the work that MTS provides and the trip service that MTS provides in the community. And then there are two categories of non-Medicaid trips that are discretionary at the county level that we have been providing up until this point. Maintenance of health trips, which you see here, medical that are non-Medicaid, adult daycare, grocery store, food bank, farmers market, et cetera, and general purpose trips, which are paid employment, fitness centers, post-secondary education, hair salons, barbershops. As I mentioned, during the pandemic, we received a tremendous infusion of funding, 8.9 million total, as a result of those efforts at the federal level to shore up local communities. We use that funding to expand our non-Medicaid trip services by 28%. And facilitate social distancing by providing those door-to-door individualized trips. That CARES Act funding will be expended fully by the end of FY24, and ARPA and CARISA funding will be fully expended before the end of FY25. And so we, again, needed to focus on prioritizing the most important aspects of our trip service for our community. The trip program modifications that we are communicating effective today out into the community are as follows. We will continue, of course, all of our Medicaid trip services, continue maintenance of health, employment, and education trip services, and then discontinue general purpose trip services effective July 1, 2024, and also reinstate the $1.50 trip fare. I'll make a note that the employment and education trip services were included in the categories of trips that will continue as a result of hearing and accepting the feedback from the Board of County Commissioners in terms of wanting to ensure that those two categories of trips continued. So we did post my presentation to the board, add employment and education trips into the category of trips that will continue going forward. Our strategy will help sustain our future operations. We are really at capacity with our ability to deliver and serve in the community well. And this streamlining will really help us improve our customer service. The $1.50 trip fare will help offset vendor-related expenses to the tune of about $170,000. And we will continue to provide services that help meet the most critical health needs of the community. This is the data around our service in the non-Medicaid space. I shared this again during the board meeting. If you take a look at FY24, you can see as of for the period July through February, about 650 individuals who avail themselves of the general purpose trips. And again, we are adding back into our plan for continued trips, those who participate in education and employment, which is about 150 or so. Our communication plan will focus on several key stakeholder groups, which you can see here. Certainly you all, the commissioners, community and business partners, aging networks, active clients, and certainly our MTS advisory board. Our tactics are multimodal, and that is because of some of our requirements related to the receipt of FTA funds and also just our desire to cast a wide net in terms of how we communicate this program modification. I have to give credit here to Alex Burnett, who's back in the back there in our public information office. He has worked hand in hand with us since the time of our board presentation as we work through this, and we believe we've developed a very solid plan. So we are required to communicate the adjustment to the reinstatement of the trip fare and also these trip modifications for a 30-day period, a notice period out into the community, and provide multiple ways that individuals can respond and give comment. So I'll talk a little bit about that here, but we are endeavoring to spread the word using multiple means, digitally, web page updates, newsroom stories, direct communications. A letter will go out tomorrow. We have phone bank scripts that our team internally is equipped with, and we will have flyers in multiple languages posted in our vans for distribution. In addition, we'll have newsletters, your board bulletin, we'll have information, talking points, FAQs if you need them, community relations team within the county will be partnering with us on town halls. We will lean in with our age-friendly Mecklenburg team to spread the word. The town hall structure will canvass across each of the 6 county districts that we have, and I'll show the schedule here shortly. The customer and partner letters are linked in this presentation, which you have electronically. So we wanted to make sure that we are not only notifying our constituents, our clients about the change, but also making sure that our key partners just are aware of what's happening in the community, and that we are highlighting for members of our community alternative transportation resources that are available to them. And so we wanted to make sure those alternative transportation resource partners knew that we were putting their information in our distribution. We have also reached out to those partners so they are aware that they may receive an uptick in calls as people seek alternative means of transportation. The timeline here, we've got today. We're going to launch after this with our 30-day notification period, distribute resources to the board and others via mail and snail mail and web-based platforms. We will start our town hall meeting series on the 4th. It will conclude on the 14th of June. And then all of the program modifications will be in effect July 1, and the $1.50 fare will be reinstated effective as of that date. The town hall meeting schedule is here. We kind of cut a swath between afternoon times, morning times, evening times, in an effort to allow the community to come in and connect in different spaces and at different times that may be available. In addition, our web page will allow for written comment. People can always mail in comment as well. We will have FAQs on the web page that will answer some of the more pressing questions and also be a resource for commissioners if you need it. Did I make it in time, time-wise? Okay.
You're perfect, perfect.
That's all I got.
Ms.
Macy, did I
Henderson,
miss anything?
absolutely perfect.
Okay.
Let me look to my colleagues. We have, well, look to, let's see how many 3-minute rounds we can get. You want to start with Ms. Henderson since she's already
Okay.
up at the podium? Okay, all righty. Commissioner Powell, you get first dibs.
Okay, so you added education and I'm flipping through my- Employment. If someone needed to go to a community resource center and they didn't have a car and they had this need, would they be eligible?
Towards CRCs. You want to come up?
Yeah.
Just so you can be on the mic. Does this one, is it? Okay. Is that from-
Can you hear me okay?
All right. If it is an active customer,
Stand up.
let's just say
Yeah.
it would be more of the alternative resources. You can be the stand, okay.
Okay.
I'm gonna join this. So, yes, whether it's an active customer or an inactive user, because we're only serving our active customers, we would have to offer some of the alternative resources that are available, not only in the frequently asked questions, but also in the materials that will be going to the customer, letting them know about the bus passes and some of the other resources that will assist us in getting them to those locations.
I just have a concern for so many people that might not even know about community resource centers. And I'm thinking of a specific person that I learned about this week who has no way to get to a community resource center, but is desperate to get there and hopefully doesn't have to face an obstacle course of getting there, or else I have to go pick them up. And so I just wondered, because it seems like something that would be included in the trip services.
You make a fair point. Again, the bus passes, many of our CRCs are on bus lines. I think that was a very intentional situating factor with the CRCs. We can examine and explore that, but right now they are not, it is not contemplated that we would use our MTS team to transport to CRCs.
And how are we going to take the $1.50 per person? How does that work?
So there are typical old school collection boxes. Is that right?
Correct.
Yeah.
We have collected the $1.50 in the past, and we do have a manual process currently that we will reinstate until our new software becomes available for us to look at the touchless fare process and having that as an option for cash fare process.
Aspirationally, our new system will be available in January.
Fingers crossed.
Yeah.
How many people are on the waiting list for the services that we're going to provide? Because I know there was a waiting list.
Yeah.
I kept getting
I'll have to
questions
get-
about that.
I'll have to get back to you on that one. Do you know the exact number?
Yes, I can. Currently, the interest in service is about 168 since we started the planning process.
Did you see any abuse of services that were discontinuing?
Any abuse of service?
Like ridiculous, like, any requests?
No
for,
comment.
No comment.
I'm with you. I don't want
No.
to comment on that because we
No.
know that there's a need.
Yeah, no.
I meant for the ones discontinued. Like, there's a reason we're discontinuing them. So I'm thinking that people not,
Well-
in addition to budget.
So well, frankly, the budget is the primary motivation for the discontinuation and our desire to continue to provide excellent service. So it is, we did not experience abuse in the space of someone overusing the opportunity to go to barbershops or fitness centers or anything like that. That was not a factor in the consideration around modifying the TRIP program.
So the budget is a piece of it. We don't have the capacity to meet the demand with our current infrastructure, either with our MTS fleet or with our contracted vendors. So we're missing X amount of trips per day because we just have straight real capacity issues. We've done an RFP to get more vendors. And I don't know, where are we with that RFP?
We are in the selection process, but I don't expect that to be ready until the first part of the fiscal year.
Yeah, it is. I mean, it is very interesting when we get complaints from the board for missing trips for dialysis and some of the other medical trips because the fleet is so stretched doing all of the other trips that are non-mandated. And so we want to focus on the priority trips to make sure that we right-size our fleet to meet the demand.
And the reason, I have one more question. The reason I'm asking all these questions is because if there's a tiny fleet and a big need. How do we prepare our future budgets so that we can meet needs better? But also, my question is, Commissioner Altman was very concerned, and I share the concern about special needs population, maybe people on the autistic spectrum needing a safe place for transit. Is that included in the ones that are continued?
So if an individual is disabled and they are receiving the trips, it would depend on the category of trips, where they are seeking to go. There's no exclusion for individuals who have physical or mental health disabilities or what have you. As long as we have that documented proof of the disability, it's the type of trip, their destination, that will be the factor.
Thank you.
Commissioner Meyer?
Thank you very much. And as you know, I was at the Tyvola Senior Center. And the number one thing the seniors were concerned about, we answered a bunch of preset questions, but it was transportation. And very passionate and a lot of angst over it. And one of the things we heard was, are they limited to 4 times a month? Do you know anything about that?
Are they going for what purpose?
It depends on the purpose of the
Okay.
trip in terms of the number of trips that are allocated.
And that's not necessarily the Medicaid trip, it's just in general. That includes that as well.
That purpose would be for non-Medicaid trips because the Medicaid is mandated.
Okay. And who are our, okay, actually, before I ask that question, when it says discontinued general purpose trip services and you have government, does that include, I know a lot of seniors pay their bills in person. Does that include that?
It does. It includes financial institutions, other nonprofit organizations, yes, government organizations. So it would not, the discontinued trip category would include a trip, for example, to the electric company, if that's what you're asking.
So that is discontinued.
Correct.
This is distressing. And I understand I understand why. It just is distressing to know that we're losing these services. And my next question is, who are our partners?
So there's and in the customer letter and in our resource letter, we have a list of, I think it's 9 or 12 by my quick eyeball count. So we have certainly CATS Paratransit, PACE of Southern Piedmont, Shepherd Center of Charlotte. You will have all of these materials. First and Families by InReach, Metrolina Association for the Blind, Supportive Services for Veterans Families, Disability Rights and Resources, Road to Recovery, and North Carolina Division of Services for the Deaf and Hard of Hearing, just to name a few. We have more, but those are kind of the primary ones that we're including in the letter to our constituents and community partners.
Okay, and they're very focused on, the one you just mentioned, the deaf patients, that they're focused on that. And it sounds like most are just focused on not general, but specific reasons for transport.
We do have, yes, Commissioner. So we, a number of the alternative transportation resources focus on particular constituencies, which is in line with whatever their mission-based focus is for their organization.
Okay. All right, thank you.
Commissioner Rodriguez McDowell.
Thank you, Mr. Chairman. I just was wondering on page 4, where it says maintaining current service levels would require an additional $1 million of revenue in FY25. Is this already in the proposed budget from the county manager?
The new trip structure, the contraction of trips is in the proposed budget. That's correct.
The contraction, but
yes,
this funding.
This addition, no, it is not, because this is what the gap would be to close in terms of, do you see what I mean? This
okay.
is, in order to stay at the current levels, which is all of the trips, maintenance of health and general purpose that we are running right now, it would require this additional infusion, which is
Okay.
not in the FY '25 budget request. We did add, though, back in education and employment. So this figure has modified just a little bit. I think it's to the tune of $600-some thousand that was added back in for education and employment.
Okay, thank you for that. And so do we currently offer like some kind of vouchers or something for taxis or reimbursement to CRC centers? We don't.
No.
Okay. I don't know why I had that in my mind. Okay, that's all my questions.
Good idea, though.
Yeah,
All right.
but that would require more money in the budget.
Any other questions before I ask my questions? Going once on this one. Okay.
Well,
Good on this one?
I want to reinforce what they're saying.
Hold up just a second, Mr. Trotman. You good?
Yeah.
Okay.
Yeah.
All right. My one question is, can we figure out who the customer base is in a more refined way that would give us an opportunity to advocate for $1 million? Because right now, just saying to add $1 million into the budget to help senior citizens, but can we talk about who we're currently serving in terms of if they're all on Social Security, are they disabled, are they poor? I mean, do we have a capacity right now to define who our customer base is? And if so, that would certainly help me in trying to figure this out, because one category that you moved over called fitness centers is really health. Because my mother-in-law, for example, before any of this COVID money, would leave from Beatty'sford Road and go up to McClory Y with transportation. I don't know if it was county transportation or city transportation, but it was government transportation. And so does the city have the same program or similar program?
They have cats.
Okay, I don't know whether it was cat she was getting or county. Anyway, I knew that she was going from Beatty'sford Road up to McClory Y for exercise. But Mr. Trotman, you were going to say something, so go ahead.
So the 4 standard managed care plans also offer transportation services.
Okay.
And so when they talk about Medicaid transportation, it is this special category, and it's in the thousands of trips. And so budget is a piece of the issue. It's really capacity. When we expanded the trips during COVID, ridership was down. And thus we were able to expand to all these different areas because people were not moving around as much. And there was some special funding streams for us to offer different types of trips. Before COVID, we were not offering all these different types of trips. So now after COVID, we don't have the capacity. You can add the budget, the dollars back in there, but we would get back into missing certain trips until this community has a larger plan around transportation.
But that's what I was asking, because you just said if you're on managed care, they pay for transportation. That's what I say. Who is the customer base? If the customer has alternatives other than the county, they ought to be using those alternatives other than the county. But if they're not on managed care, and if they're on Social Security, I don't think Social Security pays for trips per se. VA may do some of that for transportation, depending upon where they go to a VA hospital. But if we could sort of carve down on our customer base, then you're absolutely right. Those folk who have alternative methods of getting to doctors or to other places. But if we could figure that out, you're right. So how do we do that? That's my question. How do we figure that out in terms of our alternatives?
Commissioner, we do have data some of that I shared in the meeting, the regular meeting in April. We do have data around racial demographics, zip code. Maybe we can backtrack into income levels, et cetera. So there's a story that we can tell. Certainly I can share in terms of who we are serving, but many individuals do have alternatives available to them. We do largely serve a lower income population that has, by virtue of that fact, the availability of other alternatives by virtue of their income status. So that we can certainly share the data around the demographics on our ridership in that respect.
All right, well, let's go to community violence because it's hard for me to raise taxes and some senior citizens are going to be left out that don't have any options. Okay, so but we'll continue the conversation. All right, let's go to
Turn that off.
guns in the neighborhood.
Smaller.
All right, questions for the way forward and community violence. I'll start with Commissioner Meyer first, then Commissioner Powell, then Commissioner Meyer. Commissioner Rodriguez McDowell.
Thank you.
Commissioner Meyer.
Thank you for your presentation. And on the page where, I don't know that, I think there's a number, but it had milestones. And you talked about handle with care.
Yes.
I want to express my complete and total surprise that this wasn't already happening in the schools. I had no idea, but I used to teach. And so when a child misbehaves, there's a reason for it. And if something has been traumatic in a child's life, they're going to misbehave, they're going to act out somehow.
Correct.
And they're going to get removed from the classroom, and then they're going to miss learning, and so on and so on and so on. And it's a cycle. And so I really am surprised that this hasn't been happening, that they, the schools haven't been alerted. So this is good news, and so my question is, when will it be open to, I'm surprised it's just starting with so few. When will it be open to all?
Yes, so right now it's in the Freedom Division. To my understanding, out of the rest of the CMS schools, it will be going to have the second year. This is the first year, and then the remaining in the third year. So by the third year of the program, it should be in all of the CMS schools.
So is it a privacy issue? Is this why
Why
schools
it's
have?
being phased out? I don't believe so. I think it's just been piloted with the Freedom Division since
Okay.
it's new.
Okay.
Yeah, I'll just chime in here. One of the issues that we've had over the years is that there initially were some concerns related to privacy. Many were concerned that there would be this divulging of information, not only from our law enforcement partners to the schools and vice versa. And so we wanted to make sure that we were working out those details, but the biggest portion of that is providing education about what the program really is. And it's not so much that the traumatic event is being disclosed, but just to let them know that there is something that happened and that those youth will need additional supports. When we looked at really rolling this out, we know CMS is a very large district and CMPD has jurisdiction over Charlotte. And so we had to really begin looking at where we could implement this that was in alignment with certain schools. And so we considered looking at doing this in alignment with certain divisions within the school district, but it was easier to look at those schools that were within certain CMPD divisions. So we began by looking at the Freedom Division and all of the schools that entailed, and now we'll be expanding across other parts of CMPD divisions.
It's wonderful. Thank you. My other question is in the intergovernmental page. I guess there's always confusion between city and county and what the city does, what the county does. And I think with our public safety initiatives can be confusing for the public because, CMPD is not us. But you do work with CMPD. It is part of because I see the city of Charlotte, Housing Safety Community it's confusing for me too. To try to figure out what we do, what they do, and what the difference is, and is there overlap and that sort of thing. I mean, I see that you're communicating what we're doing. Do they communicate what they're doing?
You're saying the city?
The city, sorry, yeah.
I can take that. So the Way Forward plan, although the county took the lead on the plan, is a countywide plan that does include input from city as well. So the core team of community advisors, one of those 3 advisory committees, does include leadership from the city, including the city manager, representation from CMPD, along with county management as well. So there's a joint collective effort to make sure that all parties are involved and informed of collective strategies.
Okay.
So it's the chief, the sheriff, city manager, and county manager on that advisory board.
Okay, that answers my question. Thank you.
Commissioner Powell?
Thank you. So there is so much here, so much, and then acronyms are always interesting. But thank you for talking about the collective effort, because I think it's really important that we keep talking about partnerships and how we all work together. I do have some questions. The first one, you went over a lot of different things. Do we have anything that we hyper focus on de-escalation techniques? Is there part of any program where we're really talking about how to de-escalate some really tense situations?
Yes. So I believe alternatives to violence, so that violence interrupter team are the ones that really prioritize de-escalation tactics, because they're in the community. They're able to interface face-to-face with residents after an incident, before an incident. And so I think that will be the one that will really highlight those techniques out of the programs.
And what is the training that they take for that?
It's a Cure Global Violence, I believe, model. So it's a training they get to learn about how to interact with community residents and different tactics and strategies when you're having conversation, when you're hearing about different things, how to approach them and things like that. So.
And I might jump around on your presentation because I have so many questions.
No
but
problem.
Ebony, when you started, you were talking about an increase. One of you was talking, I think it was Ebony, talking about an increase in young Black men committing suicide and having like extended periods of depression. Do you have any data to say why? Like, is it bullying, or do you have any data on that?
So these are some of the recent numbers that are coming out of CDC nationwide, that we're seeing an increase in young Black males dying by suicide. There have not been sufficient studies yet to document why that is happening. But I can tell you, just in some of the qualitative work that we've been doing in the community, and speaking with many of our adolescents and our young adults, that they're experiencing a lot of difficulties, not only in coping with the emotional stress that they may be experiencing, but many of them who are already in a vulnerable place, and now that we're coming out of the pandemic, are experiencing much more difficulty in finding some of the resources that they're in need of. In particular, we have heard a lot about housing, a lot about family and community support, and a great deal about economic futility that they're seeing. They're just really struggling economically as well. And so many of the young adults that we have been speaking with, in particular from the 100 Youth Advisory Council, have called out some of these issues that are leading to this rise.
And so you talked about some of the partnerships. Do you have any partnerships? Because I get phone calls about this, about keeping our recreation centers open later for a lot of youth that might be struggling. Do you have any partnership with Park and Rec or workforce development?
That's a great question. So we actually recently begun partnering more with Parks and Rec and the YMCA. Some of the work that we're doing collaboratively is really ensuring that many of our youth who normally don't have access to some of these recreational spaces do have access, and that includes being able to have memberships, for example, at our YMCAs, and be able to do some of those activities and events later on in the day. We know that as we begin looking at the summer months, that is usually a concern for our youth in the community, that they don't have a safe space to gather and thrive and play. And so in talking with our YMCA partners and our Park and Rec partners, we're just looking for opportunities there where we can ensure that our youth have something to be able to be a part of, especially during those months when they're not in school and they have less access to many of their peers like they normally would.
And on top of the memberships with the YMCA, we've also worked with them to get youth in their day camps. And so like you said, during the summer, they have something to do during the day while their caregivers may be at work. And they were also looking to get them in some of their training programs. So like the Lifesaver program, not Lifesavers, is that their stuff? Lifeguards, thank you. The lifeguard program, so that we can also encourage them to get jobs and use those skills throughout the summer and throughout the year.
I really want to help with that. However, I can help with, getting our park and recreation centers open later, how we can connect better with workforce development, how we can do more with equine therapy. I think that's really important. And I just, during COVID, I had a phone call where a business owner was what I felt like was suicidal. And this is why I will always be like #1 fan of Ebony, because I was on the telephone for about 90 minutes with this person. And I kept thinking like he could kill himself. And as soon as he hangs up. And my husband was mad that I stayed on the phone. And I said, how could I hang up? But then I called Ebony and I said, I didn't share any personal information because he didn't authorize that. But I said, I just really want to make sure that he knows he's seen. And I feel like, I think that's so important to know someone is heard and seen and feel their energy and try and help them. And so Ebony helped me. I mean, it's traumatic. Like COVID was traumatic for elected leaders who were listening to the anguish of some small business owners who couldn't pay their own employees and didn't know what was coming. So Ebony was just so valuable. And I want everyone to know how real you are. Like when people, you want to be seen and heard, and you saw and heard me and you helped me help him. And so he's still alive. And, I used my creative skills to check up on him and say, well, would you consider going for a walk in nature? I was trying to think of what he might do. And so he did. He took me, because I told him really beautiful places to go in Mecklenburg County in our park system. But you helped me help him. And however we can increase touch points to see people and hear them, to keep them from suicide, to keep them from being violent. I really hope that you will invite us to the meetings where you're doing trainings, because, we get invited to all kinds of fancy stuff. And sometimes I feel like it's nice to be invited, but I want to be in the meaningful stuff. Yeah. So if you could invite us to, you don't even have to introduce us, just to see what kind of training they're getting, I would really appreciate it.
Absolutely.
Thank you. Sorry for
All right,
that.
Commissioner Rodriguez McDowell.
Thank you.
Thank you, Mr. Chairman. Okay, well, I want to reiterate what Commissioner Powell said about the parks and rec centers and stuff like that. If you guys thought that was a way, to have those places open, I've heard the same conversations kids need a place to go. If we need to expand that, I really want to hear that from you guys as the professionals that you are, to tell us, yes, we think that really would be a viable thing, because that's the kind of, budget that we would want to go to bat for. And so really would love to hear your feedback about that. Also, I wondered, the 100, this is just a yes or no question. The 100 Youth Advisory Council, was that created just for this, or was it already doing other stuff?
It's created, yes, just to get the recommendations and provide them.
Okay, so it's the sole focus. Awesome. And I wondered if the town police forces, I can't remember, are they helping with the Handle with Care program, like the towns?
I am unsure about that.
Okay.
I believe we've been reaching out to many of our towns because as we look to expand across CMS, we will need to include them as well.
Right.
So as we continue to move forward and expand on it, they are being included in that process.
Okay.
But up to this point, we've solely been focusing on our CMPD partners.
Right. Okay, that'll be in the third year maybe as things move out.
Right.
Okay. All right, awesome. And then I just had a sort of technical question about the stats, and I'm sure there's good reasons for this, but in the first few pages, there's a lot of blanks. Like for 2021, number of percent of teens reported carrying a weapon, Mecklenburg, North Carolina, and the US, it doesn't show anything. And then MEC doesn't show anything for the next one down, but the other ones are populated. Can you help us? What is stopping us from being able to get the data? And is it hindering, the work?
That's a great question. So much of this data was collected from the Youth Behavioral Risk Factors Survey. I always get that mixed up, but I didn't want to give you another acronym. And so those surveys are only collected every couple of years. And so the reason we don't have any of that information from some of those years is one, because of COVID, and two, because some of those surveys were delayed. And so we're waiting to get some data, while other data we don't have for some of those years.
Oh,
So
gosh.
our next set of data will hopefully be published soon, and we would be able to update this with the most recent data.
Does this fall under the disaster that, was brought about by the General Assembly and there's silly rule about you have to opt in instead of opt out, or you have to, whatever the thing is with CMS questionnaires?
I don't know if that impacted this because that is a newer rule that has been implemented with this current school year. I will say that there have been some significant implications with us being able to do the work in partnership with CMS. Some of the work that we identified in the strategic plan originally was written to be done within CMS schools or within our charter schools, but due to the change in rules and opt-in, we've noticed that there are a lot of activities that require opt-in that many parents in our community either don't have access to accept or have not been able to accept. And so even for things that public health might be doing, like vision screenings, has a very low rate of return. And so us being able to deliver some of these programmings within the schools, we had to do a pivot. And so some of these things we're no longer doing in the schools, such as the 100 Youth Advisory Council and some of the work that we're doing with our local trauma experts, we're instead doing them through community agencies that have access to youth who go to those schools.
Wow, that is incredible. That is simply blows my mind. Let me just say really quick, I'm a #2 fan of Ebony. I know you're #1, I'm #2. I just want to say thank you for the work that you guys do. I mean, all of you guys that are in this work, you come up and you give us these presentations that seem kind of clinical, but I know that that's not your main vibe. And so I just want to say thank you for the work that you do. Really appreciate you guys.
Thank you.
Is that it?
Yes, sir.
All righty. My one or two questions, I guess we both to Mr. Trotman. Both of these, but particularly this presentation reflects, it's only $500,000 basically. The other stuff is grant money. It's like $7 million worth of grant money in there. Okay. What will it take to really move from like a mile wide to an inch or two deep or foot deep so that we'd be able to see some impact in some of the areas? Just sort of depressing in one end when we hear about all these opportunities to open up rec centers. I saw my first person murdered as a 6-year-old on 7th Street, probably 4 blocks from here in front of Tetero Grocery. And all of this, academia around trauma and all. What helped all of us was a sense of hope in the community and places to go that we could identify with. Although it was all segregated and all poor, we took advantage of what we had in the neighborhood, okay? As a grown-up working at Legal Aid Society, we did some work with a program called Office of Juvenile Justice and Delinquency Prevention. I don't even know if it exists anymore through the FBI. And we went out in some of the projects. And what worked was relationships, but not transactional workshops, but relationships. And 40 years ago, commissioners, we talked about why can't the schools open up? And when I chaired the board, we tried to say, can we put more money? Because the fight at that point was who's going to pay for maintenance and janitorial service. Maintenance at a gym, cleaning up. And here I am, I'm a county commissioner 40 years later, getting ready to raise taxes. And we can't open up government buildings on the weekend. And I don't know if you were here then, but the county partnered with the schools and the community off of West Boulevard since there was so much drugs and violence. We do this crap all the time. It makes me just pissed off. But we gave up Amy James Center. We renovated Amy James Center, and we're gonna do all that. And then we just kind of went away. I mean, if we're really serious about these suicides and all this other stuff, tell me, staff, county manager, how much money does it take to have some impact on this particular topic? And that's what I would hope, Mr. Trotman, that he's not going to be able to do it by Thursday, but it would be helpful going down the road if we continue playing these games around suicide and community violence and stuff. What would it take? And then see if these elected officials got the gall to raise taxes for real stuff. Okay. Or we just go back, continue playing the game. So that's my request for the staff is how do we help these wonderful, talented people to do more than just a mile wide and an inch deep? I mean, to drill down for that. So if that's my only comment, and we're at 2:28. I don't know what else to say, but I just wish we could read. And we always talk about Black kids. Y'all have heard me. You've heard me. You know, Black kids this, Black kids that. Okay. What they don't have the money to join the Y or Boys and Girls Clubs or a little bit of upward mobility, education. You know, we know what to do. We just have to have elected officials willing to raise their hand to do the right thing. You know.
But Commissioner Griffin, I think we're sitting right here.
Well, okay. Well, we're going to do something on transportation. We're going to do something in terms of you need just throwing the money out there is one thing, but I'm saying help me say we can go a foot deep if we had X resources. Share that with me. That's what I'll fight for and put on the table if you can do that. All right. And that's not to put you on the spot, but
I don't feel on the spot.
That's my comment.
Can I say one thing?
Well, we're at 2:29, but let Mr. Troutman respond.
Okay.
And then we get close. We have to close up.
So the part I wanted to say is I love that you said what got you through it was a sense of hope. And so at the end, you know, you were talking about storytelling. So before we leave, after Mr. Trotman gets to say his piece, I would really like for you to share an experience that you've had that gives you hope. And so that was what I wanted to, because I think that's important.
I don't know if you want my personal experience or my personal professional experience, but I can tell you that, you know, just as we were discussing here, as a child growing up in destitute poverty and often wondering where hope could reside, there were a lot of people around me who helped guide me into a better situation. And education was a big part of that for me, but I can also tell you that the people who were supporting me had to know how to support me. And if we can look at opportunities to support the helpers who are helping those children, then we can do a better job of really reaching those children. Many of the people who are doing the work in the communities are completely overwhelmed and feel lost. And as we reported on some of this data, we said that many of our youth are feeling sad and hopeless most of the time. I think if we can find a way to support those who are already doing the work with those youth to help elevate their voices and provide them with a sense of hope, it will give them a reason to feel like they don't have to pick up a gun and feel that nothing matters anyway, right? So we as leaders in our community have to do a better job of reaching those who are already doing the work and help support them to support the youth that they're working with.
And I'll quickly say, just to really listen to the youth, I've attended some of these sessions. And to hear them, like we look at them as the problem, the rates are rising, but if you really take the time to sit and have these conversations with them, they have a lot to say about what's going on with them, how they really feel things will change for them, whether it's in the school or the community. They truly have a lot to say if we just sat and listened and then actually execute some of the things that they need. And so I would say, as well as helping the ones who are taking care of them, truly sitting down and listening to what they have to say.
All righty, we are at the end. I'll reach out to my deputy county manager again. Any parting comments before I ask for a motion to adjourn, sir? I appreciate the presentations, both from transportation, from Ms. Henderson, and from both of you and the whole team for your work. I just wish I could be there with you, but thank you for what you do each and every day. And I'll see if we can get some numbers and we'll do our part. Mr. Trotman.
Well, thank you, commissioners, for your attention to these pressing issues. As you know, in HHS, we have over 110 different programs that we administer here in the county. You've heard about 3 of them today. So very important programs. But as we look at, what our role and responsibility is, there is a capacity issue both inside the county and in the community to meet all of the needs of the community. So I thank you for, again, your attention. I thank the presenters. And I like to say personally, I've been a big brother to 4 different young men. I've started 2 different mentor programs and I ran 2 different community organizations. And so what I've learned personally is that kids want and need the personal touch. They need the one-on-one relationship. They don't want buildings by themselves if there are no people in the buildings to support them.
Right.
And so this gets into the capacity issues of many adults, young adults, have young families and they're at home in the evenings. And so we continue to have the rub. It's not about the building, it's like, how do we create the balance? And so it is an ever challenging issue, not just here in Mecklenburg County, but throughout the country. But definitely hear what your request is. I'll talk with the manager and others and figure out how we can meet the needs of the board.
I'm chair of the committee. I'm going to take a point of personal privilege. We work with kids to play basketball. But before the kids could play basketball, we wanted to know what their homework was in math. And we got information about math. And so the referees that we hired were community folks. And they had in their back pocket the math homework that the assignment was. And if this kid went up and shot the basket and hit 2 points, the referee would go in his back pocket and say, okay, what's the square root of 81? If you couldn't answer that, the 2 points didn't count. Okay?
Gosh.
So there are all kinds of ways that you can move forward and help youngsters not be so depressed if they're flunking math, how the community could help them master math and still have fun.
Yeah.
So none of this stuff is new. We just have to do it. And I hope that my wonderful colleagues will not get bored with me talking about those things that are happening, but I'll continue to talk about them whether you get bored or not. Is there a motion for adjournment?
So moved.
There's a second?
Second.
All right. All those, any discussion, all those in favor say aye.
Aye.
Opposed, same sign. All right, let's go to the next meeting. Thank you. Thank you. Oh, I tell you.
If you have a question, student, you can come up here.
No, I just wanted to thank you guys. I'm a nurse at Belmont, and I see a lot of students have patients in GSW. I just really